wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to the program today. I'd like to discuss with you a problem that is commonly seen in individuals as they mature, and that's the issue of high blood pressure. Blood pressure is simply a measurement of the amount of pressure the blood exerts on your vascular wall, on your arteries, as it is pumped out of the heart and into the system. We like to see blood pressure it's measured in milligrams of mercury. We like to see a perfect blood pressure would be 120/80. We like to and so in blood pressure, the top number is the systolic pressure. That's when the heart contracts. That's called systole. And that, of course, pressure goes up, and then as it dilates, diastole, then that's when the pressure falls. So when the heart contracts, that's the top number. When it relaxes, that's the bottom number. And again, a perfect pressure would be 120/80. We like to always try to keep the diastolic, the low number, 90 or below. We don't like to see it above that. And on the top pressure, you're in systole, we like to see it stay 130, maybe at the most, maybe 140 as a person ages, because some people do have atherosclerosis and some hardening of the arteries, so their arteries are more rigid, which means the blood pressure is going to rise. We'll see, it's not uncommon to see people's systolic level to be corresponding to their age. So if they're 60, they often have it 160. If they're 70, it's in the 170s. That's too high. We like to keep that down below 140, 130 down. It's hard to get people at that age down into the 120s, but you can. But the long and the short is, when you have high blood pressure, that can cause damage. One, it causes the heart to have to work harder to pump the blood through the arteries. And again, high blood pressure is caused when the arteries, when people get high blood pressure, the arteries become thickened and they may become atherosclerotic, and they're rigid, so they don't relax as much. So when it's kind of like when you squirt water through a hose, if you've got a knob on the end of it, you can tighten up and you get a strong stream, or you can open it up and it just sprays out gingerly. So the narrower the arteries due to atherosclerosis, the higher the blood pressure is going to be. So what we want to do is keep the arteries healthy, and we want to help them relax so the blood pressure is lower. Now, high blood pressure can lead to heart disease, heart attacks. It can lead to heart failure. It can lead to strokes. As your pressure gets high, you can pop a fuse in your brain, pop an artery. It can cause kidney damage. It can cause problem with vision and a host of other health problems throughout the entire body when you have high blood pressure. So we want to get the blood pressure down. We like not for it to go up. So there are some things you can do to prevent high blood pressure. One, that's to stay in an ideal body weight. And secondly, to make sure you exercise. Those are two things that are easy to do. And that has to do with the way you eat. You got to change your eating habits to eat organically, to eat a keto diet, and to cut out your simple carbs and your sugars. If you do that, you'll prevent coronary artery disease, and you will live longer, and you won't have these problems. Now, if you do have high blood pressure routinely, this is diagnosed at the doctor's office. One out of every 4 individuals that goes into a doctor's office with regular blood pressure, their blood pressure will spike when they're in a doctor's office. That's just caused by the tension that a person has and the concern they have. It'll jump up. I see this commonly, and I'll simply ask somebody, just calm down. Take a few deep breaths, blow out slowly. Let's just get your blood pressure down. And you can talk it down 10 or 20 points that way, very simply. Another thing can be done if you have a blood pressure cuff. You can read it at home or away from the doctor's office, and it routinely be normal. Unfortunately, many doctors will start people on blood pressure medication based upon the reading they have in the medical office. I think that's dangerous to do that. I think it needs to be read away. You need to have several readings, and you need to read them away from the doctor's office. If you do have high blood pressure, you should not be put on any medication. The first drug that doctors will always use, conventional doctors, is diuretic. What that does is causes you to urinate out magnesium. When magnesium low, the pressure goes up. So invariably, individuals go on a diuretic. They come back and the pressure's still up or higher, and the doctor then put them on a beta blocker, put them on an angiotensin blocker, or a calcium channel blocker. And all of these have some significant side effects, and you don't feel well on them. So what you want to do is, one, get down to an ideal body weight. Change your diet. Second, exercise. Third thing you can do is you can take magnesium citrate or magnesium glycinate, either one of these. And I recommend you take probably 800 milligrams a day or 900 milligrams a day. It will loosen up your stools, but you won't have problems with constipation. I'll assure you of that. It'll keep you clean, but it'll lower your blood pressure. I've seen many individuals that have come in on blood pressure medication. I've said, okay, here's our goal. Let's get down to an ideal body weight, lose 2 pounds a week, and let's get down to your ideal body weight by eating a ketogenic eating program, and that means cutting the simple carbs out. Second, I want you to exercise. I don't want you to go running. I don't want you to run a marathon. Simply go out and walk a mile or two every day, or jump rope, or swim, or bicycle. Get some exercise, and then take your magnesium. Another product we have here is Neo Forte, which is got a nitric oxide blend. Nitric oxide dilates up your arteries, as does magnesium. Magnesium is excellent as far as dilating your arteries, and these products can be used simply, and your pressure will be lowered, and you will cut out your risk of having a heart attack or heart disease. Now, and I don't have to remind you too, some other things that can be very helpful too is restoring your hormone balance. So good, healthy, natural hormone balance is important to maintain throughout your entire life. As we age, men and women, our hormone levels decline. That would be our sex hormones, testosterone in males, progesterone and estrogen in females. And those can be replenished naturally to keep you feeling young and rejuvenate you. So you have energy and you have vitality and you've got enthusiasm for life. Well, that's what you can do for blood pressure is get on a program of proper eating habits, proper exercise, take some magnesium, maybe some nitric oxide proactive preparations that will stimulate nitrous oxide production in your body in order to dilate up your arteries. All this will help you lower your blood pressure and keep you off blood pressure medication, and you feel a lot better. I'm Dr. Hotze. Thank you so much for joining us today. We look forward to having the opportunity to serve you here at the Hotze Health and Wellness Center.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.